this is how we can work on improving knee flexion while at home with usually stuff around the house, right? So for example, let's say this was my replace side. Okay, option number one, I set up a chair, my toe is against the wall. Right here, I know that's not 90 degrees yet. As I scoot my hips forward, the wall is pushing me into flexion, right? As my range improves, I move a little closer. As I move forward, I move a little closer. Now, the goal would be my toe is touching and my knee is touching. I can't get more range of motion than this. The drawback to this position is the ankle. So it's hard to keep my heel down and my knee forward. It's a good stretch, but it's difficult to do. It's challenging. But that's fine. Like, so this is going to be, heel down is going to be more knee flexion. Heel up is going to be less knee flexion. But now where do I go from here? If I can get to this, I can start to grab a little step. So this is a 10-inch step. I put my foot up on here. Now again, I slide forward. I scoot my chair in. I slide forward. Eventually, I'm going to get to the point where I'm touching the wall. Now, this is even more knee flexion, right? And then, of course, there's a 12-inch step. I can set it here where the step is between the legs of the chair. Put my knee up. I slide into it. As my knee flexion improves, I continue to come in. This would be full range of motion. Like, absolutely, if I was to measure that joint angle, it's well past 120 at that point. But then other things I could do to supplement what this feels like is I could get a ball. I can have the ball in between my knee and the wall. And so what that allows me to do is it allows me to create a little bit of pressure on the tibia. So we know that the tibia needs to move back to improve knee flexion. Certainly, I can use my hands to kind of create these little mobs. I'm pulling back into it, but I can also have that ball in position. And what we find is that the knee tends to respond better when the pressure for the flexion is high on the tibia than low. So I might have somebody come into this position, try a typical protocol of like 3 episodes a day. They get to the point of discomfort but not pain. They spend 10 to 15 minutes in this position. I could be looking at my phone, I could be reading a book, I could do whatever I need to. And repeated bouts of this. What I like about having the foot up on the step is that it takes some of the pressure off the ankle. If my focus is knee flexion, I don't want anything to limit the improvement in knee flexion. I don't want a tight ankle or a tight hip to be a limiting factor. So this is generally considered pretty comfortable, easy to set up. Most people have a chair, a wall, a step, and a ball or something comparable. It could be a folded up pillow, it could be a rolled up bath towel. But this is a great option to just let yourself spend 10 minutes, 15 minutes, 20 minutes, 3 times a day in this position. And then of course, if I have my rolling pin, I can do my rolling pin massage through here. That's it. Okay.